Yeah, Scott, the Department of Health identified those variants on Friday, and not one, but two new variants out of California. Today, we spoke with the Mississippi Medical Association about how they identify these variants and what this means for Mississippians. Daily COVID-19 cases are relatively down, and Mississippians are rapidly getting vaccinated. But the state's battle with COVID-19 is far from over, and health officials are now concerned about these new variants.
A variant is simply a slight change. Some of those slight changes may make a virus more easier to transmit, easier to catch. That's one of the things that's been seen with some of these variants. They can be 50% or more easy to catch.
Dr. Mark Horn, president of the Mississippi Medical Association, says these new variants could be anywhere, and there's still a lot we don't know, which makes them even more dangerous. So far, the Department of Health identified variants from the UK, South Africa, and now two from California. But how does the Department of Health find these variants? Dr. Horn says through genomic sequencing and random sampling.
Genomic sequencing is literally looking at all of the little genetic code in that virus and seeing if it's changed from what we call the wild type. And the wild type is the original COVID-19 virus that came over in the beginning of the pandemic.
Dr. Horn says these new variants form and spread easier when people don't take safety measures like wearing masks and social distancing. He says to keep daily cases low, people need to continue keeping their guard up. And Dr. Horn also says that one case of the South African variant identified in Harrison County, they believe that it was a result of traveling, and they also believe that it could be isolated, and that's what they're hoping for. But we do know that at least 10 cases of the UK strain have been identified in the state. And like Dr. Horn said, these variants could be anywhere. Live in Jackson, Cecil Hannibal, 16 WAPT News.